Okay, this is Dr. Mark Petropoli. We're back again with Carl Calabrese, Dr. Carl Calabrese, who's our physical therapy and rehabilitation coordinator at Victory Sports Medicine and Orthopedics. And we're going to be doing a telehealth visit. It's not a practice visit. Carl's an actual patient as well. He's been kind enough to agree to have his visit filmed today. So first and foremost, we usually have to do a verbal consent. So I'll just read this to Carl and he can let me know if it's okay to continue. So it says this telecommunication visit is occurring over a HIPAA compliant connection, which means it's a secure connection with our electronic medical record system. This visit will not be recorded, although we are actually recording it with Carl's consent. Usually they're not recorded. An office progress note documenting today's visit will be created and stored in your medical record. There are potential risks to this technology, including interruptions, technology quote unquote hiccups, and technical difficulties. You have the right to discontinue this telemedicine visit if it is felt that the video or audio connections are not adequate for the situation. So do I have your consent to continue with this telemedicine visit?
Yes, you do.
Thank you. And I usually tell the patient if it looks like I'm not looking at you, it's because I have another computer. Most of the time we're doing these with 2 computer screens. I actually have the luxury of having 3 right now, but normally in the office it's 2, or sometimes we can split the screen on 1 computer. Carl's here for a reevaluation of his left shoulder pain. Where's the location of your pain, Carl?
It's kind of in the back, right here.
Gotcha. So the last time we saw you, it was back there, and then also, was it up on the top in the AC joint, or is that better now?
I'll get a little AC joint irritation if I'm doing a lot of like home projects and repetitive stuff or anything overhead, like painting ceilings. I'll get a little AC joint irritation, but other than that, that's fine.
Okay. And just to recap quickly, this has been going on for about 17 years. Originally occurred when you were snowboarding. You fell, subluxed your shoulder, had some pain. You saw an orthopedic surgeon in Jamestown, New York. They did x-rays. There was no fracture. And you did a lot of exercises on your own at that time. You got better. But then in 2007, you had another subluxation where your joint slightly popped out and popped back in when you fell on an outstretched arm playing flag football. Being the skilled therapist that you are, you treated with self-exercises. Your symptoms waxed and waned over the years, but you were able to tolerate it doing your exercise program. And then in September of 2018, you were doing a lot more weightlifting. You noticed the shoulder was bothering you more. We saw you in the office at that time. That was back in December of 2018. We did the x-rays, which we showed earlier on the previous video that showed a little cystic area in the glenoid, the socket part of the joint. You can kind of see this little white area on the MRI here as well. And so we did talk about surgery, but also you were able to kind of get it better doing the exercises on your own, modifying the weightlifting. And then let me know, first of all, if that's accurate, and secondly, catch me up on what's been going on since then.
Yeah, so things have been pretty good. I'll still have episodic pain, but I'm able to self-manage it at this point. I started swimming. I mean, that's the best my shoulder's felt in years. And then since this quarantine, we've been doing a lot more house projects. I've been doing some overhead painting. I've been trying to work out my basement and probably pushing it a little harder. And I'm just feeling a lot more like fatigue, and with certain movements, anything out and kind of move inside to side, I'll feel almost like it wants to sublux or it wants to let go, and I'll get like a quick stabbing pain and then it'll go away. Certainly left shoulder fatigues quicker than the right with anything at shoulder level or above. Anything at my side, I'm good. And that's pretty much it.
And you're left-handed, correct?
That's correct, yep.
So it says that the pain is aching, sharp, and stabbing at times. Is that accurate?
Yeah, like the stabbing pain will be those quick movements where I don't think I can stabilize myself in my shoulder joint. Or those unexpected movements, it could be as simple as lifting up to pick up a small piece of paper, and I'll feel it at times, but then I can lift up 40 pounds without worrying about it.
And that's usually the posterior pain in the back of the shoulder, pretty much.
Yeah, that's always the posterior pain. It'll occasionally radiate kind of laterally, but predominantly about 2 inches kind of below the AC joint posterior is where I get it.
So 10 is the worst pain you could ever have in your life, and 0 is no pain. You put in here that it's a 5 at its worst and a 1 at its least. Is that still accurate, or is there times when you have no pain?
No, it goes down to a 0 most of the time.
Okay. So
unless I'm doing something I shouldn't or unexpected.
Okay, so we'll edit that to 0 at its least, and then what would you say it is at its worst?
It's probably a 5 or 6 at its worst.
Okay, so we usually take the higher number there. So it used to be constant, at least when I saw you last time, so now we'll change that to intermittent, meaning it doesn't always occur. And then in the past, it was aggravated by lying on the affected side, pushing and reaching behind the back, as well as deltoid raises and flies. What would you say would be what aggravates it now? Is that still accurate?
No, I can sleep through the night all right. Anything kind of going into internal rotation, especially behind my back, is stiff and tight. Pushing it, trying to stretch that out, doesn't make it better, makes it worse. Delt raises with too much weight, or if I'm fatigued out, will kind of give me that instability feeling.
Okay.
Push-ups are fine. I cannot bench press more than 185 pounds. Otherwise, I know I'll hurt the next day.
Okay. But by the way, on that, where do you find your hand position is the most beneficial for you with your type of problem?
I usually kind of go with thumb away from kind of that the clean part of the bar, not where the grip is, and that seems to work out pretty well for me. But under high load, I think I don't get a good scapular set, and I start to tip a bit. So I probably need to focus more on my form when I get higher up than the weight I'm moving, to be honest with you.
Okay. And then basically the alleviating factors. In the past, you said heat helped a little bit. I don't know if you're heating it, icing it, and then obviously your own rotator cuff and your own periscapular, your own strengthening program, I would assume.
Yeah, so majority of the time, just staying strong is the best thing for me. And just kind of limiting a bit of the overhead stuff or anything, too strenuous, just breaking it up a bit more.
And you said you still have a little bit of limited range of motion behind your back, and then do you still get spasms? I mean, in the past it said there was some spasms.
No, I haven't had the spasms since it got real bad in 2018.
What about like any mechanical symptoms like catching, snapping, popping, locking, anything crazy like that?
I'll get some cracking in the AC joint, but more with end range movements after I've been stiff.
Okay. Now, we can probably have our awesome nurse Brandy go through your past medical history and all those other things and update that. But since December of 2018, has anything changed in your medical history? Any new medications, surgeries, medical problems, anything?
Nope.
Nothing?
Still healthy. Looking good.
Okay, we'll have her go over that. Now we get to the physical exam part. Now, a couple things for patients.